The quality of public healthcare in rural Limpopo is making strides that will rival that of private healthcare soon. This comes with the recent addition of 3 more high-end CT scanners at the province's regional hospitals. As one of the country's poorer provinces, Limpopo's public healthcare provision has been lacking, especially in the more rural parts. Our reporter Hitikani Magweze brings us the story.
It's deemed as the Ferrari of CT scan machines, and it's in service to those who otherwise wouldn't afford its top-end specs.
Yeah, it's a 64-slice multi-detector CT scan. It's one of its kind. It's the Canon. Canon's a new company also, so we're using the latest modality in the province actually. It's quite fast, and it's a multi-planar scan, like I say, the MDR. It does all head to toe, like in milliseconds.
It's set to not only save lives, but save the government on medical lawsuits.
Now we can scan roughly, it's 50 patients per scan, 250 scans a day. And we're just getting less than 50, 100 a few years ago. This is the first time that we'll see, our states will say 250 CT scans in the province. Now we can really save life with evidence-based medicine. Doctors don't have to shoot in the dark anymore. They'll have their reports. Now you'll have one evidence-based medicine, which means the lawsuits are going to go down. The millions we're paying on legal fees are going to completely drop to probably, I'm expecting less than 5% for the whole province. That's number one. Number two, patients are going to get what we call diagnostic criteria type of treatment, which means a doctor doesn't say you have a headache. I don't know whether it's an aneurysm, whether it's just a migraine. Now you'll know it's meningitis, and you give specific treatment for meningitis.
Effectively, this thrusts Limpopo's limping health system into the fourth industrial revolution.
This image was taken from this scan here on Tuesday. It's an image of a baby. Lucky enough, the names are not there. So taken from this machine, I access it on my phone. You can see it. It's a CT brain, pre-contrast. The diagnosis is there. It's one of the patients. This scan was supposed to be sent to Mankwin. Patient comes back. Wait for the report because it's going to take a bit of time, a week or two. Now this patient was scanned here. 30 minutes later, the report was released. I read the report and I look at the images. My registrars were here. They did the study and they did the reporting.
However, this is only one step in the right direction. Infrastructure remains a nightmare.
The equipment that we have been procuring, that we've been buying, it's there. But I can tell you, in terms of issues of infrastructure, at least in this hospital, there's a bit of activities. You can see we're trying to renovate there and there. But I can tell you in a majority of our facilities, our hospitals, to me, that is a headache. I don't know where will we get the money.
Even worse for the department, the Treasury has instructed it to cut off a little over 2 billion rand from its budget, adding salt to the wound. For Newzroom Afrika on Channel 405, I'm Hitikani Magweze.